Alrighty, my type 2s, if you have followed along, you know that I talk about target ranges and near normal ranges for diabetics. You know that I believe we should be trying to mimic as near normal ranges as possible as diabetics, right? Chasing that type of control is powerful, but it depends on how you do it. And there is a difference between those who are treated with medication and those who aren't, right? If you are treated with medication, we have to be very careful about lowering glucose ranges. It has to be done with data, and it has to be done strategically, okay? Versus someone without medication can go a little more aggressively because the chance of overtreatment and dangerous lows is reduced significantly. So if you are on medication and working at lifestyle modification to affect blood glucose levels, keep your data written down. Easier if you're on a CGM because you do get warning if there's going to be a low or an impending low. But keep that data, and if you see consistent fasting blood sugars under 100, or any times that you are dipping down regularly under 100, that is when you need to communicate properly with your prescribing physician, okay? Supply them with the data, explain to them what you're doing, because that is a point where we start to worry about overtreatment and dangerous lows. If you're not medicated, the chances of you going low is significantly less common. So just know that if you've been running elevated blood sugars for some time, you might feel the symptoms of a low blood sugar, although your blood sugars are still in normal range. And that is not a failure. That is your nervous system recalibrating to a decreased glucose level. So watching your sugars, understanding what they mean, knowing when there are signs of overtreatment, and communicating properly to your medical professional is imperative in those situations. So reducing blood sugar to near normal levels or aggressive target ranges can be done. It has to be done safely, smartly, and in communication with your prescribing provider. If you have any questions, reach out.